We don't have any doctors, we don't have any clinics, we don't have anything like that.
It's a problem in many rural communities across the country, and one Ford County board member wants to do something about it. Good evening, I'm Brandon Morano. Jessica has the night off. The CDC says there's a striking health gap between rural and urban America. WCIA3's Scarlett O'Hara joins us now. Scarlett, tell us more.
I spoke with a Ford County board member who says in his village, the closest options for medical care are in Gibson Area Hospital and a clinic in Paxton. And while that might be an easy drive for young, healthy people, it's enough to prevent others from getting checkups, which means sometimes they don't know they're sick until it's too late.
I want to give you a reason to move to my area. And that's a struggle every day when you ask me questions like, what do you have for health care?
The answer is almost nothing for 9 towns in the Ford County district Tim Nuss represents. While Roberts, Illinois has a population of only a few hundred.
I could fill this house and then some in the gymnasium with people that need it, want it, and are begging for it but don't know where to turn.
He says the COVID-19 pandemic unmasked the issue of rural health disparity in his community.
We had so many people dealing with that stuff alone, and they didn't want to bother anybody. Oh, it's a cold, it's the flu, or something like that. No, it wasn't. No, it wasn't.
He's hoping other Ford County board members will join him in making a change.
We've learned from what happened then, and we're going to make things different. We have to.
The CDC reports people in rural counties die from the top 5 causes of death more frequently than those in urban areas, and many of those deaths were preventable. Contributing factors include lifestyle differences, environmental conditions, and aging populations. But the CDC says these regions also have higher rates of poverty and less access to medical care.
They're cutting back in every way they can, and I know a lot of people are cutting back on their health care.
Sure, there's a hospital and clinic a couple towns over, but Nuss says they're busy and appointments are often booked out a month at a time.
And that's no fault of theirs. They're doing the best they possibly can, but some of my people need it, and they need it now.
Transportation poses another challenge, especially for people who are already sick. It's an issue on State Senator Tom Bennett's radar as well.
The distance driving, it's not just around the corner. That's part of what rural, Illinois is about. And so trying to find those ways to resolve some of that is a challenge for sure.
With enough help, Nuss is hoping he can bring more providers and more care to the people in his district who need it.
We work together in these small towns. We have to keep them together.
So what can be done? Nuss has a few ideas, including bringing mobile health clinics to small towns. He says early disease detection is important, and he doesn't want his district to be left out. Back to you.
All right, thank you, Scarlett. An American Hospital Association report says 17 rural hospitals closed nationwide in 2020, the most of any year in the past decade. It also says the remaining ones face significant staffing shortages because only 10% of physicians in the United States practice in rural areas.